So the theoretical part of your research, that is आपके experiment, the research designs, hypothesis testing, sampling, all these things, assumptions of various tests.
So yes, like Anantika said, the anxiety and stress, it's very real. Obviously, it comes with when you're studying so much for it, different universities, you're looking for different universities.
For the clinical, you will get a certain idea about what the course will offer you, how clinical psychology will look like for you. फॉर एग्जाम्पल अगर आपने क्लिनिकल लिया है तो आपको थोड़ा सा डिसऑर्डर होता है, डिसऑर्डर्स के बारे में पता चलेगा, डीएसएम से आपको एक्सपोज.
When you pass out and you get placed in everything, does it matter where you pass out, like the college that you pass out from, or is it just enough that you've passed out from an RCI recognized college?
About what exactly is M.PHIL clinical psychology for all our audience here, and then we'll move to the panel discussion. So M.PHIL clinical psychology is a postgraduate course, and it focuses on the theoretical principles as well as ensures experience with patients and clients in the hospital setting. So as per the Mental Health Care Act, which was given in 2017, a clinical psychologist is required to hold an M.PHIL to practice as a licensed clinical psychologist after getting an RCI license. And since a lot of us had doubts whether M.PHIL clinical psychology would be continued after the NEP 2020, however, M.PHIL would be continued in clinical psychology because it is not just a theoretical course. It is a hands-on experience where you practice in the field. So it is more of a training program, and hence it will be continued. Now, regarding the entry requirement for M.PHIL, so you require a minimum, the minimum educational qualification is a 2 years of master's or MSc degree in psychology from any university which is recognized by UGC, and the minimum mark criteria is 55% in aggregate, and for SC/ST the criteria is 50% in aggregate as per the Government of India. Now, regarding the admission procedures, so the selection committee of each institute which organizes or offers M.PHIL, they usually take up entrance test, which is a cumulative of a written test followed by an interview. And different universities have their different tests. So if you want to know about the specific test of a particular institute, you can either check out our Power Within Instagram page, or you can stay connected with us in the community group. We keep posting about there, and some of the famous institute, if I have to name, then it would be IHBAS, it would be IMHH, it would be GFS, it would be NFSU or Galgotia, and so many more. So you can check those details out. I'll post the link in the description. And regarding the duration, so M.PHIL is a regular degree. It is a 2-year regular degree, and you require a minimum of 80% attendance, where you also work in the hospital setting. And if due to any health condition you are unable to complete it in like the 2 years, then you have to complete it within 4 years at any cost from the date of enrollment. Otherwise, it is not valid.
So, very warm greetings, respected panelists. And on the behalf of students, there is a very pertinent question that I think we can start from, and you can share your experiences and thoughts from being a student, from being a mental aspirant to actually becoming a licensed clinical psychologist. How do I decide as a student whether this course is appropriate for me or not? Is this course for everyone? Should everyone just go?
So the thing is, I don't think that is true for any course if you go to see, right? Like you just can't jump into any course. जब आप अपने मास्टर्स में होते हो एंड जो आपका जनरली जो आपका 3rd या 4th सेमेस्टर होता है, योर इंटर्नशिप पार्ट एंड द पार्ट वेयर यू नो आपको क्लिनिकल की प्रॉपर नॉलेज देते हैं वहाँ पे. सो आई थिंक दैट इज़ अ गुड डिसाइडिंग पॉइंट इफ़ यू रियली genuinely interested. And before actually sitting for the entrance exam, and before actually making up your mind that I want to enroll myself into this course, the first thing that is important is try to find out, do your research before entering the M.PHIL course and see what the course actually entails. Okay, what exactly is the course structure if you're ready for that kind of workload, because it is extremely different as a course जब आप अपने मास्टर्स में होते हो और अपने मास्टर्स से आप M.PHIL में जाते हो. it is an absolutely different course. And if you ask me, as my personal experience, M.PHIL was a roller coaster ride because it was like an absolutely different arena that we jumped into. So you need to assess whether your personality, your interest area, and your workload part, if you're ready for all those things and you're genuinely interested in pursuing and seeing patients, if you see yourself as a clinical psychologist and that as a work kind of work that makes you happy, then definitely you should go for it.
But how students can decide, or what are the things that one should decide whether I should go for M.PHIL or not?
Okay, so I would take it up next. So I think I really agree with Anantika here that internships can be a good starting point for you to decide whether you want to go into the field, whether you want to pursue your, you want to go ahead and pursue MPhil, because there, you meet with patients, you interact with patients, you really get to know it through internships, because internships, if you've done it in hospitals or any other place where you've met patients and you've had clinical psychologists around you, so you get to experience what kind of work they do, the assessments, therapies, everything that goes on in the clinical psychology part. So you get to experience that firsthand, and there you're just someone who's observing it from from a third person's point of view, so you can really decide it there that if it is for you or not. You can really see for yourself whether you're interested in the field, whether you are interested in conducting those sort of interviews or sort of assessments, therapies. For myself personally, I was really not aware of what clinical psychology really had to offer before I got into my internship at Wimhans Hospital, and there I experienced what reading from ICD, reading the criteria, reading about different disorders. It actually was what the experience that I had there. From there on, I always, whenever I used to meet, any kind of population in different hospitals or internships, I used to always look for that, the disorder part. My brain always used to go there. So there I decided that, okay, this is what I'm really interested in. So internships can be really, really helpful to, help you decide whether you really want to go into the clinical field or not, or whether you want to pursue any other area of psychology. You should definitely go on for internships, even if they're not a part of your curriculum. You should, voluntarily go for them and experience other fields also, so that you have a comparison point whether clinical is for you, because once you might go into clinical and you may feel, okay, this is really interesting, but then when you experience something else, you might find that, okay, this is also something interesting and I would want to experience or explore this. So, you should experience different paths and then decide for yourself whether clinical is something that you want to do, or you want to pursue some other, field of psychology. So that comparison point should also be there for you, to be able to decide and have a, better understanding. That is, I think, what worked best for me.
Thank you, Mr. Ji. That was very descriptive. I think we can take some points from here that if we are thinking to go into clinical psychology, we should definitely start from, at least from our masters, to explore this field. And I come to Shivani ji now. And Shivani ji, thank you so much for joining. We know that you're not feeling good. So uh, it's really great that you could join us. I'll definitely like to have your take on this.
So, what's the question, Vishal? Can you please repeat it?
So, yeah, definitely.
Yeah.
So, how a student can decide, because when we are completing our masters, there is a doubt or confusion in our mind that कि हम M.PHIL clinical psychology करें या ना करें इसके बाद, whether should we go further for this or not.
Okay. So I completed my master's from DU, and in the last semester, in the last 2 semester, in the second year, basically, we will given a choice whether we want to opt for OB or in clinicals. So if we opt for the clinical, you will get a certain idea about what the course will offer you, how clinical psychology will look like for you. फॉर एग्जाम्पल अगर आपने क्लिनिकल लिया है तो आपको थोड़ा सा डिसऑर्डर होता है, डिसऑर्डर्स के बारे में पता चलेगा, डीएसएम से आपका एक्सपोजर हो जाएगा, आईसीडी से आपका एक्सपोजर हो जाएगा, तो आपको थोड़ा सा बैकग्राउंड पता चलता है कि क्लिनिकल साइकोलॉजी में होता क्या एग्जैक्टली। एंड देन आपका 50 डेज इंटर्नशिप भी बहुत सारे इंस्टीट्यूट में ऑफर करते हैं, तो जब आप इंटर्नशिप करते हो तो आपको आइडिया पता चलता है अच्छा डिसऑर्डर्स है, ये सिम्टम्स होते हैं, कोर्स वर्क कितना है, मुझे कितना पढ़ना पड़ेगा, इसमें थेरेपी कैसे होती है, क्लाइंट से इंटरेक्ट कैसे करना है, तो आपको वो दूसरा एस्पेक्ट जो अभी तक नहीं पता होता है मास्टर्स के स्टूडेंट को, वो आपको पता चलता है साथ में। तो इट इज वेरी नेसेसरी फॉर अ स्टूडेंट टू गो फॉर इंटर्नशिप्स and all the opportunities which a person can get to know more about the clinical psychology.
Right. And just an add-on to this question for all of you, even if I have internships experience, even I have gone through, even I've been exposed to clinical field. Should I go for a diploma in clinical psychology? Should I go for M.PHIL in clinical psychology? And one doubt remains in all of the students' mind. How will it be different from masters? Because we never see what the M.PHIL students actually do in their training. We don't have an idea. So yeah, so how do I know that as a student, how it will be different from my master's experience and master's training?
Okay, so I'll take this question. Okay, so
Yeah.
in masters basically सारा theoretical and concepts part cover करते हैं basically, and in M.PHIL you basically cover about all the disorder parts. Okay, and masters के बाद आपको कोई भी license नहीं मिलता है to practice independently, but after M.PHIL you will get the license part. Okay, एंड पेशेंट्स 1-to-1 आप देख सकते हैं, आप साइकोथेरेपी कर सकते हैं उनके ऊपर, एंड आपका पूरा जो हम लोग का प्लान होता है फ्रॉम हिस्ट्री टेकिंग टू एमएससी एंड देन साइकोडायग्नोस्टिक फॉर्मुलेशन देन थेरेप्यूटिक पार्ट, सो वो हमारा पूरा एमफिल में आप कर सकते हो, एलिजिबल हो। बट अगर आप मास्टर स्टूडेंट हो तो आप ये सब नहीं कर सकते हो। मास्टर में आप आफ्टर डूइंग योर मास्टर्स आप एज अ काउंसलिंग साइकोलॉजिस्ट वर्क कर सकते हो, बट नॉट एज अ क्लिनिकल साइकोलॉजिस्ट, बिकॉज अकॉर्डिंग टू आवर से यू नीड अ लाइसेंस टू प्रैक्टिस इन इंडिया फॉर द to work as a clinical psychologist.
Sure. And Mr. Ji and Anantika ji, what's your take on this?
Right. As I just like to add on to what Shivani said. Basically, जो भी आप मास्टर्स में पढ़ते हो, right? मास्टर्स में आप पढ़ते हो, उसी चीज़ को प्रैक्टिकली जो हमें अप्लाई करना है वो एमफिल में हमें बताया जाता है। इंटर्नशिप भी अगर हम करें, दैट जस्ट गिव यू, इट्स जस्ट गोना गिव यू लाइक अ बर्ड्स आई व्यू कि ऐसा ऐसा होता है। All right, once you are in the field, once you already enrolled in the course, you get to do all of that practically. Right, you are the one who's dealing with the client, you are the one who is applying assessments on the client, you are the one who is doing therapy. That patient becomes your responsibility then, right? So that's what happens. That's how MPhil, to sum it up in just one line, is like जो भी आपको theoretically पढ़ाया जाता है in your masters, you get to do it practically and hands-on experience मिलता है आपको in MPhil. That's what the difference is. And जो भी points उन्होंने कहा कि license मिल जाता है and you get to practice independently, all of that happens in MPhil.
Also, yes, also Vishal, you asked about diploma PDCP course, right? How is that different, right? So in SGT, I can give you the aspect of SGT. So in SGT, the course is the same. आपको सारा सेम ट्रेनिंग मिलती है, योर सुपरवाइजर्स आर सेम, आपके जितना आपको जो करिकुलम होता है वो सेम होता है, इट्स जस्ट दैट रिसर्च पार्ट नहीं होता है पीडीसीपी में। MPhil में research is there in second year, you have to take up a dissertation, so वो part नहीं होता है। and PDCP में जो भी बाकी चीजें MPhil में 2 years में पढ़ाई जाती हैं, they have to cover all of that in 1 year, except that dissertation part. Then after your after you're done with PDCP, you are eligible as a you get the license as clinical psychologist associate. So you can't teach in government institutes, but yes, there are people who are practicing independently after PDCP also. So RCI has not given a very good distinction between like the two courses, because हम curriculum भी same ही पढ़ते हैं, and after that you are eligible to practice as a clinical psychologist. So उसमें बहुत ज़्यादा distinction नहीं है. It's just that the main distinction I found was कि dissertation part नहीं होता है, no research stats and research वाला part वहाँ से missing होता है. बाकी the curriculum is the same, and you are a clinical psychologist associate after PDCP.
So that's something new to know, Nishtaji, that that is why the confusion is there, that whether we should go for the diploma or the M.PHIL. And if the confusion is actually is this, that we know the license will be there, but we don't know, will there be a difference in the training experience or the learnings that will go through? So yeah, that's there. So at this point of time, I would like to say to all the participants here that this is an intimate session. There is no formality here. You might be having a lot of questions right now. You can ask those questions in the chat. In the end, we will go through all of these questions as much as we can, because Shivani ji is also not feeling well. But we will try to take most of the questions. You can put the questions in the chat window. Some of you are doing. Thank you. And as you see, we have been taking up questions from the scratch, and we will be taking further questions on M.PHIL. So you can stay here with us. This is the first part. I would also like to share with all of you, most of you might know, that we do a series called Insiders Insight. And this is actually one of, we are bringing the 4.0 Insider Insights 4.0 series. And this is an informal first learning part that we are doing right now. And after that, we'll be having a lot of interactions with such resource persons who can be helpful to you. Now, Goshil have some questions from you guys, and we will be taking those questions with the panelists from their experience and their knowledge. Yes, Goshil, I think you can unmute yourself now.
Since we talked about MPhil and how it is important and how it is different from PDCP and like the other diplomas in clinical psychology, I would want to ask you, how was your experience when you gave it? Like, what were the thoughts that you had? Because I'm pretty sure that all the aspirants here, they must be having same feelings. So I think to put them a little at ease, how was your experience? Like, how did you go about your MPhil entrances?
All right, the associated anxiety and stress is very real because of the number of seats in the country. ओके दैट्स लाइक द फर्स्ट थिंग, बिकॉज आपको अगर आप किसी इंस्टीट्यूट में अप्लाई कर रहे हो और आपके लिए 5 सीट 6 सीट है एंड उसमें भी वो कोटाज में डिवाइडेड है, दैट गेट्स एक्सट्रीमली डॉन्टिंग अ टास्क दैट आई एम स्टडिंग सो मच, व्हाट इफ नहीं होगा. ऑलराइट, सो यू नीड टू गेट इनटू दैट, जो आप उस एक्सपेक्टेशन के साथ घुसो दैट आई एम गोइंग टू गिव माय बेस्ट, बट कम व्हाट में आई एम जस्ट गोइंग टू डू व्हाटएवर इज इन माय कैपेसिटी, I'll do it, right? So, jo stress and anxiety is a very, very real feeling because of the number of seats, right? So, when I was preparing for my entrance, IHBAS for the general category had 5 seats. And that also got cut at the last moment because the EWS category came and they cut it down to 3 seats. So, that became even more difficult, that why am I even going? Like, I'm traveling all the way from a different city, going and sitting for the entrance, and I don't know that 750 students are going to come and they're just 3 seats, all right? So that gets a little difficult, to calm yourself down, to maintain that composure. It gets extremely stressful, right? So yeah, that is one thing that needs to be kept in mind, that you go in with this expectation that I'm just going to do with whatever I have, जितना मैंने prepare किया है, मुझे अच्छे से आता है, and then get and sit for the entrance exam. That's one snippet of what I felt, because it was like a flurry of emotions that when you sit for the exam, when you're preparing for the exam, you have like 2.5, 3 months आप masters finish करते हो और entrance exams आ जाते हैं, so वो 3 महीने का time होता है generally. So it's like, I don't know how to explain, it just gets very overwhelming when you sit and relive that entire experience कि कैसे prepare किया था and then you got in. So yeah, that's how it is. But the stress and anxiety is very real. That's all I can say.
I think a lot of our aspirants would be like a little at ease after listening to this. कि मतलब जो clear कर चुके हैं वो भी same ही anxiety and stress के साथ है, तो we are all in the same boat at the end of the day. It's all about कि बस mindset अपना अच्छा रखें and उसके ही through हम मतलब clear कर पाएंगे and कुछ और ना सोचे, ज़्यादा thoughts ना डालें.
Exactly.
Thank you, Nantika ma'am. And what are your thoughts, Nishtha ma'am?
So yes, like Anantika said, the anxiety and stress, it's very real. Obviously, it comes with when you're studying so much for it. Up different universities, you're looking for different universities. Syllabus क्या है? क्योंकि set syllabus है नहीं, and seats कम है. कौन सी universities actually offer करती हैं RCI M.PHIL, and another thing was the duration of RCI which the universities have. So that also gives you some sort of stress ki bhai, if I get into it, they have the valid RCI for this period or not, kahan pe hai, kahan nahi hai. And so what I did for myself was I kept backup that if this does not work, this is what I'm going to do. Either I'm going to apply for PDCP or I'm going to apply for PhD or I'm going to continue working. So, having those backups, speaking to people in the field itself, those who have completed M.PHIL or those who are in other fields also, like those who are doing PhD and working also. So talking to them actually used to give me a lot of reassurance that, okay, if this does not work, then I have something else also. It's just not the end of the world. और भी चीजें हो सकती हैं, life will go on and I will do something else in the field itself, but if not M.PHIL. So that gave me a lot of reassurance.
आई थिंक ये काफी मतलब सबके लिए अच्छा रहेगा कि अगर हम अपने ऑप्शंस ओपन रखें ताकि एमफिल को ही एक अल्टीमेट वो ना रखें, लाइक 100% दें बट साथ में एक ऑप्शन बैकअप का रहे, सो दैट यू आर नॉट लेफ्ट क्लूलेस. सो आई थिंक दैट इज समथिंग दैट वी कैन डू. सो मे बी इन टर्म्स ऑफ अ डिप्लोमा कोर्स इन क्लिनिकल साइकोलॉजी और इन टर्म्स ऑफ प्रैक्टिसिंग, जैसे हम इंटर्नशिप की बात कर रहे थे, तो ये थोड़ा सा एक्सपीरियंस मिल जाए एंड उसके बाद मतलब आई थिंक वो प्रिपरेशन में भी हेल्प करेगा क्योंकि एमफिल का सिलेबस काफी हद तक साइकोपैथोलॉजी से डील करता है. तो अगर इंटर्नशिप करेंगे या फिर आपने जैसे बताया कि जो क्लिनिकल साइकोलॉजी का डिप्लोमा है वो भी सिमिलर सिलेबस ही है काफी हद तक. ड्यूरेशन में फर्क है एंड सर्टिफिकेशन में फर्क है बट काफी हद तक सिमिलर है, तो हम अपने ऑप्शंस ओपन रखें. तो थैंक यू मैम. एंड शिवानी मैम, I would want to ask you the same question, but I would want you to focus on कि how did you go about कि हमें एमफिल में एक पर्टिकुलर सेट सिलेबस नहीं मिलता है एंड बहुत वास्ट हो जाता है जब कोई भी ऐसे बैठने को करता है. तो हाउ डू यू गो अबाउट दैट, लाइक व्हाट इज इट दैट यू डिड इन योर टाइम?
ओके, सो व्हाइल आई वाज इन मास्टर्स, तो मैंने सबसे पहला काम क्या किया था कि जितने भी लोगों ने, जैसे सपोज IHBAS, RML या CIP हो गया, एनहांस, जितने भी जो लास्ट ईयर के क्वालिफाइड बच्चे थे उन लोगों को मैंने कांटेक्ट किया पर्सनली एंड देन मैंने उनका एक लिस्ट बना लिया एंड देन उनसे पर्सनली कनेक्ट करने के बाद उनसे पूछा कि क्या क्या टॉपिक्स आए थे, क्या कैसे कैसे उनकी स्ट्रैटेजी क्या थी, क्या क्या बुक्स उन लोगों ने रेफर करी थी, बिकॉज हर इंस्टीट्यूट का अपना जो एग्जाम पैटर्न होता है थोड़ा सा डिफरेंट होता है. तो उस अकॉर्डिंगली मैंने डिफरेंट इंस्टीट्यूट के लिए डिफरेंट तरीके से तैयारी करी थी. ऑल्दो जनरल बुक्स जो हैं आपके और जनरल सब्जेक्ट्स हैं वो आप कोर सब्जेक्ट्स तो सेम रहेंगे बट थोड़ा सा जो स्ट्रैटेजी होता है वो हर एग्जाम के लिए, हर इंस्टीट्यूट के लिए थोड़ा सा डिफरेंट होता है. तो मैंने एलिमनाई से अपने सीनियर से थोड़ा सा कनेक्ट किया एंड देन मैंने उसके हिसाब से अपनी स्ट्रैटेजी प्लान करी थी कि हाउ टू गो अबाउट दिस एंट्रेंस एग्जाम.
एंड इसी पे ही मतलब बिल्ड करते हुए, मतलब आपके हिसाब से सबसे इम्पोर्टेंट ऐसा टॉपिक कौन सा है जो आप मतलब छोड़ ही नहीं सकते, आपको मैक्सिमम फोकस किस टॉपिक पे रखना चाहिए जब आप एमफिल के लिए प्रिपेयर करते हो? तो
ओके, maximum I could say is like, first of all you have to cover the general psychology. After that you have to cover social psychology, abnormal, child psychology, and then research part. There are various books you can refer to. For the psychiatry part, you can always refer to the short textbook of psychiatry by Neeraj Ahuja. According to me, it's a very good book. And if you know the details about these psychopathology and rest of the things, then you can always refer to the synopsis of psychiatry by Kaplan and Sitok for the deeper understanding. For the research part, you can always refer to the book by King and Minium. And for the psychological testing, you can always refer to book by A.K. Singh and Groth. For the psychotherapy and counseling, you can always refer to the theories book by Richard Ashraf, Theories of Psychotherapy and Counseling. And for the physiology, you can always refer to the Carlson, book by Carlson. These are the core books you can always refer to.
मतलब कि हम प्रिपेयर करते हुए ध्यान रखें कि हमें अब नॉर्मल साइकोलॉजी और क्लिनिकल साइकोलॉजी इस पे तो फोकस करना ही है, बट साथ में बाकी एरियाज को भी ड्रॉप नहीं करना है.
True, very true.
And
Vishal, I have a question here that I would like to take up. If I ask the panel, like you must have given a lot of exams while applying for M.PHIL in different colleges, I'm sure. And when you try to remember that experience, do you feel that there were differences that were in the exams of different colleges, for example, Enhance or IHBAS? Did they have some differences? Like IHBAS is always said to focus on the researchers or the books who gave which theory. So, do we find these kind of focus from different institutes too?
There definitely is some some aspect which is more in one entrance than the other. Like when I gave the entrance in RML, it wasn't expected that stats or research methods would be there, and it was majorly there in the entrance exam, which wasn't expected. So yes, they do differ. In SGT, it was mostly general psychology, and IHBAS, I don't remember it right now, but yes, every institute has different focus. Some would have more general psychology question. Manipal had more neuropsych questions. So yes, these sort of patterns, they are there, and they keep changing also. I wouldn't say that every year it's the same, but you can, you should be ready to expect the unexpected also. Last year this was the focus, next year it might change also. So I asked my senior who was from RML what was her focus in her experience of giving RML. So she said it was more clinical. So I prepared more clinical for RML, and when I went there, it was stats and research, and we were just, everybody came out and they were like, what happened? What just happened? So
I
that is
remember
something.
I
Yes.
remember that time. Yeah.
Yes. So that can happen.
So thank you, Nishtaji. I'll come to the audience. So you guys are asking a lot about the books, so don't worry about that. Try to focus on what the experience of the panelists that they are sharing. They are sharing some key information that you can get only when you sit for the exam in the exam hall. And as far as the books are concerned, we will definitely consult with the panelists. We'll make a list of the books and we'll share with you guys. So this is one point we have made it, and we will share that with you. Okay? Don't worry about that. Because I understand that books names will come in and we will hear them and we'll just forget them. So we'll take care of that. So coming to Shivani ji, could you share with us which exams did you give? Did you apply for different universities or you focused for a couple of them? And how did you find any difference between their exams patterns?
Okay, so I completed my master's in 2019 and in May. So after that, I appeared for RML, IHBAS, and NIMHANS, and the fourth one is the mental hospital itself. So talking about the discrepancy in the exam and the slight difference in the exam pattern, हाँ इसमें थोड़ा सा डिफरेंस आता है बिकॉज जिस ये मैंने 2019 में अपना एमफिल दिया था तो आरएमएल में पूरा लाइक इनिशियल के जो क्वेश्चंस थे 25 क्वेश्चंस वो पूरा रिसर्च के थे एंड मैं बहुत ज़्यादा प्रिपेयर्ड थी क्लिनिकल साइकोलॉजी और जनरल साइकोलॉजी के लिए तो वो मैं एकदम से ब्लैंक हो गई थी कि अच्छा ठीक है मेरे को थोड़ा टाइम लगा उसे ओरिएंट होने के लिए ओके ठीक है ये रिसर्च के क्वेश्चन है तो थोड़ा सा एग्जाम पैटर्न में डिफरेंस होता है टॉकिंग अबाउट माय इंस्टीट्यूट ओनली सो मेरे इंस्टीट्यूट में ज़्यादा से ज़्यादा आप जनरल साइकोलॉजी एंड देन क्लिनिकल साइकोलॉजी पे फोकस किया जाता है तो एग्जाम में थोड़ा सा डिफरेंस होता है सारे इंस्टीट्यूट के
Okay. Anantika ji, same question for you.
I don't think I'll be able to answer this question because I did not give any other exam apart from IHBAS. Because I finished my master's in 2019 June, and August में IHBAS का exam था. So I just had like 1.5 2 months to prepare और बीच में कोई exam पढ़ा नहीं था. So I just sat for IHBAS and I got through it. So बट देन आई कैन टेल यू कि भास में जो मैंने देखा है, जो 2 बार का पेपर देखा है, जो मेरे टाइम का पेपर और मेरे जूनियर्स का पेपर, दैट वाज प्रीटी डिफरेंट. As in for us, like you mentioned, that they did ask the names of books, and yeah, that was one thing that was asked, and they did ask a lot of laws in psychology, right? So laws के बारे में भी पूछ लेते हैं आपसे. And when it came to my juniors who had come, उनसे बहुत सारा therapy पूछ लिया था. Like therapy is generally not expected. They asked you a lot about in-depth therapy के बारे में. They asked, as in you just expected to know कि basics आपको पता होने चाहिए कि CBT में क्या होता है या REBT में क्या होता है या BT क्या involve करती है. उसमें what they did was they asked in-depth questions about therapy and people were really baffled. So that was a difference that we saw. Like I suggested my friends कि आप books के नाम पढ़ के जाओ, आप laws पढ़ के जाओ, आप general पढ़ के जाओ. And then when you sit in the exam, you see like therapeutic aspect को पूरा cover कर रहे हैं. So across 2 years also we saw that the paper changed. So yeah.
So would you suggest, Anantika ji, to the students for that if they are appearing for IHBAS, because there is a myth, this is the myth that we go by for IHBAS, that you should focus on the researchers and the books and their names. That is
Right.
definitely going to come in to IHBAS.
Correct.
So do you think we should do that for the upcoming year?
Definitely you should keep that in mind because you never know. Like Nisha also mentioned that you never know. Na? You should be prepared to expect the unexpected.
Yeah.
The thing is, IHBAS does give you, अगर आप उनका brochure check करोगे तो उसमें there is like a set syllabus. Unlike other institutes, वो आपको बता देते हैं. It's divided into 10 chapters कि ये इतना इतना ये सारी चीज़ें आपको पढ़ के जानी है. Right, and उसमें marks division भी दी होती है. That and the maximum marks I think is given to research, clinical, and abnormal. These 3 areas cover like the maximum chunk of your marks. So I think it is important that ये सारी चीज़ें तो आप prepare करके ही जाओ, because if you're sitting for a clinical psychology paper, you cannot eliminate clinical का part तो आप eliminate कर ही नहीं सकते. Along with that, research को तो पढ़ना ही है. And like I mentioned, I don't know what exactly happened last year or 2020 के paper में उनने therapies दे दिए. So
Yeah.
you need to be prepared with everything. But the major chunk is like आप social, clinical, abnormal and research. These major areas and आपका जो general part है, that is your learning, memory, attention, thinking, वो वाला जो part है उसको तो छोड़ना ही नहीं है. Like Morgan and King, you have to be extremely thorough because हमारे भी जो paper आया था उसमें there were a lot of questions that were covered from Morgan and King. So you need, that book needs to be on your tips. That is one suggestion from my side.
Great. Thank you, Anantika ji. And I think this is really key information for us, specifically for IHBAS, because I think as students did not know that in last couple of years these kind of questions were asked. So again, this puts a question into my mind for all of you three. So we have suggested that you should study neurobiology. Okay, we understand that, but is there anything specific in neurobiology? For example, we have studied normal psychology disorders. So why are we studying neurobiology for preparation? What do we want to get out of it? What learning do we want to get out of it? So if you can share a little bit on that. And in any paper of M.PHIL clinical psychology, do we have questions related to medicines or drugs that are used in psychological disorders? Because sometimes we are also suggested that you should have a basic understanding of psychopharmacology so that you know basic drugs and what kind of drugs you use in depression, anxiety, or other kind of disorders. So if you can share with that.
Okay, so your first question, I'd like to take up your first question. Like आपने पूछा कि नीरज आहूजा से क्या क्या चीज़ें आती हैं. So once if you go back, नीरज आहूजा के last pages अगर आप check करते हो, so you'll see a beautiful list of defense mechanisms given over there. It's like everything is very properly explained. So that basically quick notes में help करता है वो आपको. It's very concise and the point is that it's very nicely given. And a lot of other things जो उसकी glossary दी हुई है उस book में पीछे. That also helps you because MCQ solve करने के लिए, because we know कि हमें elimination method use करना है to solve MCQs. सो दैट हेल्प्स यू अ लॉट। पीछे अगर आप नीरज हो जाके देखोगे लाइक क्विक नोट्स बनाने के लिए एंड एग्जाम से पहले जस्ट आपको रिवाइज करना है, या अगर आपने अपने नोट्स बनाए हैं तो उसके लिए दैट्स गोइंग टू बी एक्सट्रीमली हेल्पफुल। सो दैट इज व्हाई स्टूडेंट्स प्रेफर to study from Neeraj Ahuja, because a lot of information is given in a very short time. You can grasp information very quickly from there. So that's why I think it's a preferred book.
Thank you.
Also, I feel MSc and HOPI is very concisely and very to the point given in Neeraj Ahuja that can also be revised from there. उसके बारे में question either in the interview or in the MCQs. It can be asked. So it's बहुत concise और बहुत short, उसमें काफी अच्छे से दिया हुआ है. So that can also be prepared from it.
Okay. Right. Shivani ji,
And yeah, talking about the second question you asked विशाल कि मेडिसिन्स का कुछ पूछा जाता है कि नहीं पूछा जाता है, तो जब मैंने एंट्रेंसेस दिए थे अपने एमफिल के, तो मेरे टाइम पे कोई भी ऐसा एज सच मेडिसिन का कोई क्वेश्चन नहीं आया था। या
and Nishta ji, medicine से related question पूछे जाते हैं क्या?
I would say not to leave them, because those can be asked, like the major medications like for antidepressants or antipsychotics, जो major ones हैं, they should be, I think they should be studied in the psychiatry part, can be asked.
Okay. And one related question, for example, we might not have direct questions related to medicines, but we can ask categories of medicines
Drugs,
also.
yes.
So have you guys come across that questions in MPhil exams?
Yeah, that I think is an
Antidepressant.
important. Yeah. I think that could be. I'm sorry to interrupt, but I think कि कैटेगरीज ऑफ ड्रग्स जैसे आप बात कर रहे हो ना कि SSRIs के बारे में they'll ask you question, SNRIs के बारे में they might ask you question, just the category of drugs. तो वो तो जब आप पढ़ते हो, मतलब इफ यू स्टार्टिंग फ्रॉम अबनॉर्मल साइकोलॉजी की बुक से भी आप पढ़े हो तो थेरेप्यूटिक मैनेजमेंट देता है और उसके नीचे साइको फार्माकोलॉजिकल मैनेजमेंट जो दिया होता है, आप वो भी पढ़ के चले जाओगे तो आई थिंक यू विल बी एबल टू मैनेज द क्वेश्चंस इन द एग्जाम.
But in your experience of all of the three, do you remember that there was any question related to this? I'm sorry, I'm stuck here.
As far as I remember, like exactly, so I can't pinpoint that it was asked, but I feel it is an important part to cover in psychiatry, so it should not be left. I mean, there's no harm in doing it also.
Thank you. Yeah. I think we are clear on that now. So, Bushil, do you have any questions that you want to take up right now? And I think we can go to the participants now, and they have some questions. If you have questions, then we can go ahead with you.
Yeah, so since we were also talking about how stats is also kind of like very important part, and एक और similar exam जहाँ पर थोड़ा similar syllabus भी होता है, that is NET. तो मेरे को अभी chat में भी दिख रहे थे, there were 2-3 questions which ask कि it's like how different are NET and M.PHIL, and are the stats के question which are asked in M.PHIL of the same level as they are asked in NET, or is there like anything that one is tougher and one is easier relatively in types of questions that are asked in the two exams? Like अगर कुछ ऐसा आपको पता हो, I think अनंतिका मैम ने तो नेट भी दिया है एंड बाकी आप दोनों को भी आइडिया होगा, बिकॉज साथ में यूजुअली सब साथ में ही प्रिपेयर करते हैं, एमफिल को भी या नेट को भी, क्योंकि सेम टाइम पे ही देते हैं यूजुअली सेकंड इयर्स ऑफ मास्टर्स.
Right. So, syllabus wise, I don't think there is a lot of difference, okay? Because syllabus similar होता है. आप नेट के लिए प्रिपेयर कर रहे होते हो, साइड बाय साइड आपकी एमफिल की प्रिपरेशन ऑलमोस्ट हो जाती है. It's just that the weightage, because net is like a more research oriented thing. MPhil is like a blend of research and clinical work. So I think that is important that जब आप नेट के लिए पढ़ाई कर रहे हो, दैट कवर्स एवरीथिंग. नेट का तो वैसे भी एक है लाइक टोटली सेट सिलेबस, वहाँ पे वेटेज कभी क्वेश्चंस का ऊपर नीचे नहीं होता है. लाइक वी वर डिस्कसिंग ऑल्सो कि एमफिल एग्जाम्स में वेटेज बदल जाता है क्वेश्चंस का. समटाइम्स स्टैट ज़्यादा आती है, समटाइम्स अबनॉर्मल ज़्यादा आती है, समटाइम्स सोशल ज़्यादा आती है. दैट जनरली डज नॉट हैपन इन नेट, राइट? सो द थिंग इज दैट वंस यू प्रिपेयरिंग फॉर नेट, साइड बाय साइड एमफिल की ऑलमोस्ट प्रिपरेशन हो जाती है आपकी. And the level, if you come to ask the level of questions and like you say that severity, मतलब जो आप ये कह रहे हो कि questions का tough होने का जो level है, I don't think there's any difference as such. जो net में आता है, I think it's similar to what comes in M.PHIL only. So I don't think there's any difference as such.
Thank you, Nantika ma'am. And for Shivani ma'am and Nishtha ma'am, like, did you guys face any questions in stats which required calculations? Because I saw a question in the chat box. So, like, are those questions like theory based? Because हमने भी Kingdom Minimum की बात की कि उससे thorough होना ही होना है साथ में, and even like experimental and all of that. But are there statistics questions which you are required to solve over there? Like, did you come across any of those questions when you gave your papers?
No, I did not come across any question which required, ऐसा कोई question था नहीं जिसमें calculations were required. Mostly research-based questions are there. I think जो हम like next year, the year which followed ours, so usme I think there were a few more stats questions which were asked. So probably there were questions there. But not, I don't think that would require a lot of complicated, even if they are there, it would not require a lot, complicated, those sort of solving.
If I talk about my experience, then मेरे टाइम पे ऐसा कोई भी रिसर्च का कोई क्वेश्चन नहीं था जिसमें आपको एकदम रिगरस कैलकुलेशन करना हो. वो थियोरेटिकल एस्पेक्ट से आपका कवर हो रहा था, तो उसमें कोई भी ऐसा मेजर कैलकुलेशन का कोई भी पार्ट नहीं था. बेसिक आपका थ्योरी पार्ट था जिससे आपका क्वेश्चन आराम से सॉल्व हो जाएगा.
तो मतलब जब हम लोग कभी भी स्टैटिस्टिकल टेस्ट वगैरह भी देखते हैं या फिर हम अलग अलग टूल देखते हैं जैसे अनोवा हो गया या फिर कोरिलेशन हो गया, तो हम इनके अजम्पशंस और इनकी जो थ्योरी वाला एस्पेक्ट है, वी हैव टू बी लाइक वेरी श्योर अबाउट दैट कि मतलब उनमें हम डिफरेंस कर सके. एंड यूजुअली न्यूमेरिकल्स नहीं आते हैं. However, since we said कि I think RML में शायद नेक्स्ट ईयर के पेपर में 2-3 क्वेश्चंस थे, तो इट्स सेफ टू जस्ट नो द फॉर्मूलाज, बट मेजरली थ्योरी से ही आता है, तो कंसेप्ट क्लियर होना चाहिए. दैट इज व्हाट दे टेस्टेड. Okay. Thank you. Now I'll move to
Rishi,
the.
I have a question right now.
Hanji.
I would like to. So before that, I would like to just say that Shivani ji, thank you so much for being here when you're not feeling well. And I know it has been almost an hour. So please let us know that if you just want to go and rest, and if you're not able to continue.
5 minutes. I will be leaving in 5 minutes.
Thank you so much.
Yeah.
So I was wondering, and I think Nishtha ji can comment on this a lot better, because IGNOU students have a very strict confusion whom institutes to apply for, what are the institutes that accept IGNOU degrees or distance degrees. So could you help us with that?
Right. So in the guidelines, which are like the general guidelines for the eligibility criteria, there's there's no particular guideline that only people from regular institutes can apply for M.PHIL. But there are institutes, majorly government institutes, which have some sort of, I would say, which I found there's some sort of bias. So there it can be a little difficult, but that is why majorly I also applied to mostly private universities. I did give exams, like a lot of exams for government institutes as well, but not a lot of them. But I did give for that experience, that if I get through, let's see how it goes. But I would say private universities, I did not face a lot of bias there, but yes, you have to be good with or thorough with whatever you're saying in the interview. आपको अच्छे से prepare करके जाना होता है, because somewhere at the back of mind it is there that you are from a distance learning background. So yes, in the eligibility criteria, nothing like that is given. You can apply everywhere you are eligible to apply. Majorly, then it depends on how much you are preparing, the hard work and everything that you are putting in. But yes, private universities you can apply and you can expect that you can get into them. And not a lot of bias that I found there.
Also, when we talk about bias and unethical, you can come in here. In your experience, I know this there is nothing clear out there, but in your experience, do you think that any institute or any case that has preferred masters in clinical psychology students over masters in, let's say, any other psychology students?
No,
A lot of students ask me this question,
no, no, no.
should I do
That
masters in clinical psychology because they might prefer us?
no, 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 no. There's nothing as such कि आपकी स्पेशलाइजेशन को कोई नहीं देखता है आपके उसमें. इट्स जस्ट वट एवर यू परफॉर्मिंग, इट इज़ हियर एंड नाउ वाली टेस्टिंग होती है वहाँ पे. आपने एंट्रेंस एग्जाम में कैसा परफॉर्म किया है, आपने इंटरव्यू कैसा दिया है, इट इज़ जस्ट दैट. ऑफ कोर्स दे आर गोना डू अ लिटिल बैकग्राउंड चेक कि आप कहाँ से पढ़ के आ रहे हो, बट क्या पढ़ के आ रहे हो दैट इज़ नॉट, यू नो, because like they've said the general criteria is like 55% marks in your masters, right? They've not particularly mentioned that 55% marks in your masters in clinical psychology. They've not mentioned it so explicitly anywhere. So there's no issue as such that even if you're doing a masters in social psychology or aap karke ja rahe ho, it's just a very here and now testing. You do well in your entrance, you do well in your interview, and you clear the exam. It's a very simple process.
And Mr. What do you think about interviews? That is an enigma for us people because we don't have to do a lot of interviews up to master, at least not a lot. So, any suggestions, any tips on how to handle interviews, how to make sure that we are prepared for it?
So for interviews, majorly when you go for interviews, you can drive your own interview. That's what I feel. That's what I felt in every interview that I gave. Like you drive your own interview. Do not say things which you don't know or which you remotely know about or which you're not confident about because you can be, questioned there. So in my experience, interviews majorly asked you about if you had a research project in your masters. They will ask you about your research project or dissertation. If you did internships or you had a job experience, they will ask you questions there about that. So in those things, like in research, they can ask you your research design, your the data, sample that you took. Why did you take this topic? So you have to be thorough with the dissertation. Read your dissertation before going for the interview because they can question you from there. If you don't know it, so it will show that okay, you did not put in much effort into it. So there they will it will reflect that okay, you did it half-heartedly or you were not much aware of what you only took up in your masters. So prepare well, read about your own dissertation. Then if you have a job experience or you've had a lot of internship experiences, so they can ask you from those experiences also. Like if you were under a clinical psychologist or you were working as a psychologist, what kind of testing you used. If you have not used any test, do not, talk about it because they can ask you things, usme andar se they can ask you something. Read about those tests if you've used some tests, if you have observed some therapeutic techniques or you yourself use some therapeutic techniques, read about those, the theories about that. So I feel, jo aap bologe, you will be questioned on that. And majorly yehi cheezein are asked in the interview, aapne pehle previously kya experience kiya hai.
इससे निश्चय जी एक दो बातें ध्यान में आती हैं, मंत्रा जी आप भी बताइएगा. Is there any age limit that we need to consider while applying for M.PHIL? Because okay, first, is there any age limit we need to consider? Second, if I have a gap, because a lot of women, female students ask me that they are applying after 5-10 years of teaching or any other work. Does that matter? Does that do anything? And third thing, if I have more work experience than anyone else, can it be? Is it possible that it can make any difference? तीन क्वेश्चन है एक ही साथ आए दिमाग में.
Okay, so about the work experience thing, not a lot of big, but it's just that one place I heard it. I don't know about others' mindset, but at one place, what I heard was that the panelists prefer this is from somebody else. I did not experience it firsthand, but this is also something I heard. So they said that they preferred people who were like right out of their masters. So because they are more open to and more flexible in accepting what they're being taught, and the people who have already worked, they are a little rigid in their approach. But it did not really affect my interview process or my entrance process personally. At any level, I did not feel that I'm being preferred less than those who just those who are right out of their masters. So at any point I did not feel it. But yes, these are the things I
Do
also
you
heard
remember the
about.
name of the institute?
I think it was Amity.
The Noida campus?
No, Gurgaon campus.
Gurgaon. Sorry. I'm just trying to get a context of
Yes.
the.
Right. So that's where I heard it.
Anantika ji, what do you think about this?
Right. So, for the entrance exam that happened last year, a 55-year-old appeared for the entrance exams. So, I don't think that age as such is any bar. राइट एंड जो गैप की आप बात कर रहे हो वो गैप ईयर में ऑब्वियसली नोबडी इट्स सच अ फास्ट पेस सोसाइटी आई डोंट थिंक एनीबडी वांट्स टू स्टे आइडल आई एम श्योर दे मस्ट बी डूइंग समथिंग और द अदर एडिंग ऑन टू देयर knowledge base and their experience base. But like I mentioned previously also, it is not anything कि आप काम करके आ रहे हो तो आपको ज़्यादा preference मिलेगी. It's just that how you, particularly for IHBAS I'm talking here, that you sit for your entrance, give your entrance well, give your interview well, and you clear the exam. Nothing as such matters कि आप काम करके आ रहे हो या आपके पास ज़्यादा work experience है or you're just out of your masters, does not matter at all there. It's a very transparent process.
Thank you. I want to tell you all the participants that I know that we are going beyond the time because we are having a lot of questions and the panelists are trying to help us out. आप लोगों ने कुछ सवाल पूछे हैं CIP and enhance से related. I just want to point out here that we will be having specific conversations around that like this only, specific to each institute. So please be patient about that. It is not possible for us to talk everything out today, and we are not doing that. So institute specific conversations will be happening in the coming weeks, in the next coming weeks. So please be patient with that. As far as the book list is concerned, we will compile that, we will share that with you guys. We have talked a lot about M.PHIL institutes, M.PHIL admission processes, and M.PHIL entrance exams. Rushil has a question, and that will be our last question. After that, we will be coming to you guys, and we will see how much time we have because the panelists might not have too much time, but we will take your questions in any case. Okay, we'll be there. So this is Gushil, you can ask your question and then we will move to the participants. And a request to panelists also, we are beyond time. So please let us know if we are taking a lot of your time. You can let us know that we need to go now and we will move forward in that way only.
Okay, so my question, I think it has also appeared in the chat box. So, how was your experience of MPhil like at IHBAS for you and at STT University? Like, how would you rate your institutes? Like, how was the experience like in terms of faculty and the exposure that you got? Like, how good were they, and were your satisfaction, like, were your expectations met? So, what would you want to say about that?
All right. So, like I mentioned, when this session started, then M.PHIL as such is a roller coaster ride. Okay, you go through a lot of emotions once you're enrolled in the course. But particularly, if you ask institute specific, I think I got a lot of exposure. The kind of clients that it was like an extraordinary set of clients that I've seen there. I mean, there was such different kind of disorders that I got to see there. I mean, something that we've never heard of. So I think that was a great experience that way. The number of clients that I saw, that we had like around 900, 950 patients per day. in the OPD. The footfall was that. So that gave us like a lot of exposure. And the faculty that you say, I think my supervisor, particularly Dr. Vibha Sharma, was like really, really supportive throughout the journey. So I think that made life a little easier because it's a very daunting course. If you have to manage your academics, your exams, your training, your research, everything you have to manage. And so that work-life balance वाली जो हम बात करते हैं, that becomes a little difficult once you're enrolled in the course. So I think if you have like a good supervisor, that is also true for PhD students also. So if you have like a good supervisor, it just makes life a little easier. And yeah, so it was a good experience in terms of learning. Like I've taken a lot of learnings from the institute, which I wish to apply in my future practices. Yeah.
Thank you, Nantika ma'am. And Nishtha ma'am, what was about your experience at SGT?
So at SGT, we expected like we were not, I hadn't heard about SGT before I got into it, like before I gave the exam. So after I got into it, the experience was good. It started off a little slow because we had our seniors, and being a private college, we had we had our own hospital also. But because it was a private hospital, so the footfall wasn't as much as Anantika might have faced in IHBAS, or what people face in NIMHANS and other government institutes which are already established. So it wasn't that much, but it wasn't less also that, we did get good learning from whatever we had. But, at the end of the day, it was mostly about how much efforts we were putting into, seeing the patients, discussing the patients with your supervisor, reading about them. So overall, it was a good experience. We also got experience of, we used to have quite a few conferences and workshops in our, RCI workshops also in our university. So we got exposure of those things also, the research part also. So since if there were lesser patients, so our supervisors would involve us in the research work. So that was also something that we were doing simultaneously, and which gave us good exposure also. So it was good. The experience was actually good. It wasn't something that we expected initially, but it turned out to be good.
Thank you, ma'am. I think our aspirants here who are attending this session are kind of very lucky because उन्हें एक government institute का भी as well as एक private institute दोनों का experience मिल गया है. And जो मेरे को commonality दोनों में दिख रही है कि एक तो मतलब M.PHIL अपने आप में ही एक tough course है, उसमें कोई deny नहीं है because काफी rigorous course है in that sense. However, the supervisors that you have, that and also how much effort you put in, that makes the difference in the overall learning and the key things that you take. I think that is there for any course, but M.PHIL में शायद वो चीज थोड़ी और ज्यादा हो जाती है क्योंकि यहाँ पर एकदम से ही आपके पास फ्लो थोड़ा ज्यादा होता है. एंड इवन अगर प्राइवेट यूनिवर्सिटीज में पेशेंट इनटेक कम है या फिर आउटफ्लो कम है, बट फिर भी आप काफी एक्सपोजर मिल जाता है क्योंकि आप एट द एंड ऑफ द डे हॉस्पिटल में ही काम कर रहे हैं, तो आपको एक काफी आइडिया मिल जाता है. एंड following on this only, since आप दोनों ने M.PHIL कर ली है, तो like were there any dropout rates that you found? Because as we discussed that it is a very challenging degree, and it might be that it is not a course for everyone. So what would you like to say on that? Like were there any dropouts, and बाकी लोग का भी कैसा experience रहता है?
Right. So initially when we joined the batch in 2019, 11 of us had joined the batch, and 2021 में अभी just 8 of us were left. So 3 of them dropped out because उनसे नहीं pressure handle हो पा रहा था, and for their own reasons they had to drop out. So particularly the reason was that because of the daunting nature of the course, they were not able to sustain through it. So yeah, and that has been a lot. That like I belong from Calcutta, so there are institutes, the government institutes in Calcutta. That has been a similar experience during my internship days. I found out that people did drop out from here. 4 to 5 people did drop out, and also there is one provision in certain government institutes, and I think in private institutes as well. There's a peer-to-peer supervision जो होती है, peer-to-peer therapy होता है. So that is one thing. Like if your batchmates are good and you can go vent out to them at the end of the day, I think that is a good practice. So if you have a good supportive set of batchmates, I think you can still sail through the course.
Thank you, ma'am. And Mr. Ma'am?
No, no. In my batch, nobody dropped out. We were 6 people, and 6 of us passed out. There were no dropouts that we faced. Yes, sometimes the pressure used to build up, and some people used to feel that, okay, what if we drop out from this course? Would it be like so bad to just drop out and do something else? But at the end of the day, nobody like really dropped out from our course.
Yeah. Rushil, do we have any question from you?
No, I think now we can move to the chat box. We can
Okay,
take
okay.
questions.
Yeah, so thank you everyone for being here and staying over with this conversation. I know you have a lot of questions. And Nishtaji and Amritaji, if you are able to see the chat, you will find there are a lot of questions. I mean, the questions are not ending, and they are just pushing us to keep the questions on. So we will definitely take up some questions, though time is always limited, and we might not be able to take all the questions. I would like to share with all of you that we will be having Insiders Inside series episodes starting, and we will be having institute-specific conversations in the coming weeks. And the space and time which we might not have regarding the questions today, we might be able to take up all those questions in the upcoming sessions and interviews. Okay. There will be a couple of resources like books you asked for and the institutes, and we'll be sharing with that. There is a pertinent questions in every student's minds about the distance degree, about the specialization in masters we should do, and I think we are very much clear about that. Um because the panelist has helped us to understand that these things don't matter much. Just focus on your preparations and applications and hard work. Having said that, now I'll come to the panelists. They have been with us for almost more than an hour, and they are clinical psychologists. So they have a very busy schedule. So I'm really grateful for both of them and Shivani ma'am who had to go because she was not feeling well. I'm really grateful that you could take some time out in this cold winters and be with us and help us out with the questions that we have. I'm sure that these knowledge and information will help the students in their preparations and in their careers also. We have your questions, guys, but I think we can also thank you, Nishthaji and Anantikaji, for their key inputs, for their time and for their energy in sharing this knowledge with us. So you can please share your feedback of how you find it, uh, the session, and you can please share your um, appreciation towards the panelists in the chat window. I know you have questions too, but let's first appreciate them. Let's thank you them for their time and energy and being with us here. And if you want to ask a question now, you can raise your hand. Meanwhile, you can raise your hand and I'll allow you to switch on your mic and ask your question. Meanwhile, I can ask the panelists to, if they have anything in mind to say, to share with us.
I'm not actually able to see the chat. I don't know what's wrong. I'm not able to see the chat, so I can't see the questions.
Okay, don't, no worries. We can see the questions. We will send you screenshots. So, Khushbu, Ishita, Rashi, I have allowed you to switch on your mic. I think we can start with Khushbu. Are you there? Khushbu, you can switch on your mic. You're unable to unmute. I don't know why is that because you should be able to unmute. In any case, so let's do one thing. I can come to your question, Khushbu. Khushbu was asking, and I just want to say this to panelists. If you have to go, just let me know that you need to go. Okay, because we might take a lot of your time. So Khushbu was asking that, first of all, Anantika ji, how did you cover the syllabus in 2 months? And because there is a whole lot of syllabus to cover, this is what Khushbu is sharing. And I mean, what is your strategy? She is basically asking.
All right. Like I said, I was anxious throughout. Like the 2 months that I had, 2 months, 15 days that I had, that it was a very anxiety-provoking feeling. But the thing is that I had freshly passed out of masters, right? So that added like a bonus for me. Like everything I had covered in my third and my fourth semester, specifically, or maybe the entire of the 2 years of masters, it was all fresh in my head. So grasping information along with what I'd learned in my masters, that helped, right? And like I said, I particularly focused on the major books, as in the general psychology books that I mentioned, Morgan and King, Cicerelli and Myers. These are the two books that I had in my hand all the time. Along with that, general khatam karne ke baad, I went syllabus wise, right? Because I had one institute in my head. So syllabus जैसे जैसे दिया हुआ था और जितना chunk of marks उस particular topic के लिए दिया हुआ था, general के लिए supposing 15 marks है, तो वैसे ही करके prepare किया, राइट? सो फर्स्ट इज कि आप बेसिक्स सबके कवर कर लो, आपके पास टाइम बचता है तो आप थोड़ा इन डेप्थ जाके पढ़ सकते हो, बिकॉज लाइक आई ऑल्सो मैंशन अर्लियर कि आप एमफिल क्लिनिकल साइकोलॉजी का एंट्रेंस देने जा रहे हो तो क्लिनिकल अबनॉर्मल वो तो प्रॉपरली प्रिपेयर करना ही है, राइट? तो एक बार आपने अगर जनरल साइकोलॉजी वाली बुक्स अगर आपने कवर कर ली, मॉर्गन एंड किंग, सिसरेली, मायर्स, बैरन, ये सारे बुक्स आपने कवर कर लिए, then what I did was I started studying my abnormal and my clinical, right? I also solved a lot of MCQ questions, right? So that gives you a lot of confidence कि आप पर्टिकुलर रैली मायर्स में जैसे आप देखोगे, आप थोड़ी थोड़ी देर में पढ़ते हो, देर आर टाइनी क्विजेस दैट आर गिवन इन बिटवीन ऑफ द चैप्टर ओनली, right? So those mock tests, a lot of mock tests that I solved, I found a lot of mock tests online. Then there's this one book, GRE Psychology karke. So that is one book that, you know, that is extremely that has been extremely helpful in my preparation throughout. So that has like chapter wise उसमें mocks दिए हुए हैं, and there are mock tests, like chunk wise mock tests also that are given. So basically studying and simultaneously solving mock tests to keep your confidence at an all-time high. That's what worked for me, right? And it also helps you to assess ना कि आपका कहाँ पर गलती हो रहा है. सपोज जैसे रिसर्च होते अच्छे से नहीं हो पा रही है एंड यू स्कोरिंग लाइक 12 मार्क्स आउट ऑफ 15 या आप 10 नंबर स्कोर कर रहे हो 15 में से, so you get to know कि किस एरिया में आपको इम्प्रूव करना है. So that way.
Sometimes it also happens, no, because that we assess and we have results and we find that we are demotivated by the results actually.
Right. All right. So for that, the thing is when you have such less time, the thing you can do is like action oriented काम करना ज़रूरी हो जाता है उस टाइम पे. आप इमोशन फोकस कोपिंग करने बैठोगे उस टाइम पे, that's going to backfire for you. I think personally that works for me. So थोड़ा सा action oriented होना ज़रूरी होता है when you know that I have like this much time left with me, मैं यहाँ पर lag कर रही हूँ, so these are the areas that I need to improve upon. So I think that personally works for me.
So as all of you might see that you are able to switch on your mic now. Yes, Khushbu.
Yeah, hi Nishtha ma'am, hi Anantika ma'am.
Hi.
So my question is for Anantika ma'am. So my aim is to crack for IHBAS, right? So actually I was going through the internship programs at IHBAS and they have asked me once the pandemic is over or the situation is better, I can start interning there, right?
Okay.
So if I'm interning at IHBAS right now, I'm in my final year of my master's, only one semester is left. So does it really help me in future, as in like if I'm trying for IHBAS?
See, आप इंटरव्यू में तब पहुंचोगे ना जब आप एंट्रेंस क्लियर करोगे, right?
Right.
So you need to understand that you having interned there might give you like a slight edge because you'll know how the hospital works. But the first step is clearing the entrance exam. So for that, study well for the entrance, and then you know when once you qualify for the entrance and then go to the interview panel, because there's like a panel of people who sit, like 7-8 people interviewing you together, and they throw questions at you at that time. I'm not trying to scare all of you, but that's how the reality is. That's how it is. So the thing is, it might give you like a slight edge because you'll know the workings and dynamics of the hospital. So I think it might help.
So like 2-3 months of efforts putting into like entrance preparation is like enough, like just after the masters, because right now, the entrance exams are being conducted maybe in the end of the year, probably like December or January. So is like 2-3 months enough to actually prepare for government hospitals or the private hospitals?
I think it is enough. If you're like putting like 7-8 hours up, dedication के साथ अगर पढ़ रहे हो, so I think it is enough. And there are coaching institutes. Powerwithin is one such institute which gives you like a concise set of material, right? So you can purchase that material if you do not have time to go through each book, because you, like you saying that there are a lot of books. So there are concise materials available. So you can like, have access to that also. So that is another option that you can employ, and along with that, please just keep solving mocks. That's going to give you a lot of confidence.
And how do we decide if we
Vishnu,
should go for the net
Vishnu,
exam? Just last question.
yeah, please.
Sorry, could you
How
please
do
We
we
repeat?
have to come
decide
to others also.
Just last question, I promise. So how do we
Yeah.
decide if we want to go for the PhD, PDCP or MPhil? Like which one is the best? Like if you talk about MPhil and PDCP, it's one of like the same course, right? The only difference is the associate.
Mm-hmm.
How do we decide about that?
That is a very subjective thing. So you need to see what do you want to do. If you see yourself working as a CP, and okay, this is the fit course for you, then MPhil is a good option. Then, or if you see you want to work as an assistant professor, or you want to go into the teaching line and the research line, for that PhD is a more sought after course. So you first need to have your priorities correct कि आपको करना क्या है, and accordingly decide what course you should enroll yourself in, right?
Right, ma'am. Thank you so much. Thank you for your time.
Okay.
Vaibhav Gupta, do you want to ask a question?
Good evening, everyone. So sorry, this is my brother's account. My name is Mukti actually. So good evening, everyone. मुझे ये पूछना था कि जैसे जो मेन इंस्टीट्यूट है वो IHBAS है या फिर RML है, तो ऐसे और कौन से इंस्टीट्यूट हैं जिसमें हम अप्लाई कर सकते हैं, जो मतलब बहुत कम नोन है, लेकिन वो भी अच्छे इंस्टीट्यूट हो सकते हैं जहाँ हम अप्लाई करें? तो अगर आप बता सकते हैं प्लीज.
निष्ठा जी, आप लेना चाहेंगे?
Institutes are various, and I think each year there are more institutes which get RCI. So I think Vishal and Goshil, if you can like give a list, I think they'll be able to better help you out with that, giving out a list of what all institutes there are, which are recognized by RCI. Because at the moment, when I gave my entrance, there were lesser institutes than how many there are right now. More institutes are there. So I think a list can be given.
Yeah.
I can't name every institute. कौन से institutes हैं अभी?
Yeah, okay.
So Mukti ji, you can drop a text to us on Instagram, and we will share the latest list of RCI institutes with you. We have, as of now, I know this for sure that top colleges, it's not necessary that the top colleges provide you the best kind of training or experience. And this is what I know after talking to a lot of M.PHIL clinical psychology trainee and the pass outs. So we will share the list with you. I would suggest that find the institutes that are nearby to you or your state or city and start applying from there. Okay, because you cannot travel the whole India to apply to 30-40 RCI colleges which provide M.PHIL clinical psychology. So take the list from us, find the institutes, then sort out which are near to you and try to know more about them and prepare for them, apply to them. Okay.
Thank you so much. Thank you so much, all.
Ishita Agarwal, are you there? Whosoever wants to, yeah, please go ahead.
Okay, so first of all, I would like to thank the panelists for giving such an informative session. It's really insightful. So my question is, in the entrance as well as in the interview, do they ask about particular assessments and tests? For example, like in interview, do they directly ask you that, suppose explain the Eysenck personality questionnaire? Do they do that? If yes, then like how to prepare for those tests? Because there are so many, so like how should we go about it?
Yeah. Okay, Anantika, do you want to take it up? Yeah. So, like I said, you can, drive your own interview. So, if you have experience of that particular test, yes, you can be asked. You can be asked in-depth question also, like how many items are there, or on what theory this the test based. Manual may say they can ask you a few things. Scoring system पूछ सकते हैं. These things can be asked. It's not that if there are so many tests you have to read about all of them. Yes, you should know about most of the tests that you study also in your masters and your bachelors, but जो tests आपने use करे हैं, if internship में आपने कोई test देखे हैं अच्छे से and you have used the name कि हाँ for example आपने you've seen child population, तो child में जितने test आपने देखे हैं, they will be mostly asking you like, have you done this test, have you observed this test? If you say yes, they can then ask you things from there. Otherwise they can ask you बहुत नॉर्मल क्वेश्चंस आल्सो. इतना इन डेप्थ में नहीं पूछेंगे अगर आपने वो टेस्ट नहीं कंडक्ट किया या आपका एक्सपीरियंस नहीं है उस टेस्ट के साथ.
Okay, ma'am. Got it. Thank you.
Yeah. Okay. Thank you, Shita. Vishnu or Divya or Rashi, if anyone of you wants to ask a question.
Hello, am I audible?
Yes, Vishnu, you're audible.
First of all, thank you, Pavadini, and the panelists to actually give in-depth knowledge about this thing. My question is actually, there are institutes that offer M.PHIL without RC approved institute list as well. I think there are some I know. So is there any benefit if someone do M.PHIL from those institutes, like how they can get licensed? Because I'm in master's final year, so I am not sure that I'll get listed or my name in the list of those institute like IMANS, NIBHAN, CIP. So I'm not sure about that. So I am seeking this as a second option for myself. So is there any like way to get the license for those people who doing M.PHIL from not approved institute?
Okay, so basically, I don't think it's going to be of much help for you once you go apply for jobs, okay? Because generally everywhere they'll be like, आपका RCI license कहाँ है? Okay, to get promoted also in your job setting, or to actually join the job. Generally, once you'll see, it is always RCI approved, RCI licensed clinical psychologist that they require. So I don't think it's going to be of much benefit for you if you apply and get through any institute which does not have an RCI approved license thing, and you still continuing your M.PHIL from there.
So there is no option for people like us who do M.PHIL, like if I do M.PHIL from like non-RCI approved institute. So there any test which can be like cracked and get license?
No, not that I'm aware of. It's basically RCI like the Medical Council of India, which gives licenses for practicing doctors. So it is similar for that. RCI gives you license to be a practicing clinical psychologist. All right, so that's the difference between a master's course and an M.PHIL course. And I think you should keep your options open and not second guess yourself right now. I mean, it's totally understandable that you're going through this, that you might not get through or anything. But the thing is, like, apply to whichever places that are feasible for you, and you never know, you might still get through. So there's no point in second guessing yourself here.
Thank you so much, ma'am. Thank you.
Okay. Rashi, are you there? Hello. Divya, are you there? Do you want to ask a question, or if anyone else wants to ask a question,
Yeah,
just raise
I
your
have a
hand.
question.
Yes, Divya.
All right. So I just wanted to ask, when you pass out and you get placed in everything, does it matter where you pass out, like the college that you pass out from, or is it just enough that you've passed out from an RCI recognized college?
So in my experience, no, I haven't experienced it ki, the name of the institute has mattered. It all depends on, the kind of interview you give and the efforts you've put and the kind of work you've done earlier. So in my experience, no, the name of institutes does not matter from where you've done your MPhil. Mostly it is if you've done, MPhil from an RCI institute and you have the RCI license to practice as a clinical psychologist. That's what mainly matters.
All right. Thank you.
Okay. Shravani, I think you want to ask a question.
Hello, am I audible?
Yes, you're audible.
Okay, hello ma'am. Hello ma'am. It was a very nice session. Thank you so much. All I wanted to ask was that while going through the RCI approved list of colleges, I found that they have mentioned some years uh, in that. So is it like some colleges recognized till only 21? So if I take admission in 22, I'll not get an RCI approved degree?
Yes, generally it is like that. Okay? But inspections keep happening every year, right? So it can get renewed anytime. So I think what you can do, I don't think it's a good option to call the college and try to ask them. But the thing is, you should apply, and inspections keep happening every year, so it can get updated anytime. So that is a little tricky. So.
Okay, thank you, ma'am.
Usually what happens is that if they have recurrently got the RCI, so there are more chances that they will get the RCI again. But yes, it again depends. Sometimes they cannot get also, but yes, they keep getting renewed. And if an institute has the track record that subsequently they're getting it, so there are higher chances that they will get it this time also.
Okay, thank you so much, ma'am.
Is there anyone else? Navita and Piyusha. Navita, I think you can go ahead if you have a question.
Hello, ma'am. Thank you for this informative session. Actually, the question I had is that for specifically for stats and research side, like what basically, because what basically the questions revolve around the area of research and stats to cover each topic, and how to go specifically with research and stats. Thank you.
So, basic books of research and stats, like we've also mentioned earlier, that calculations per se do not come in the paper, right? So, the theoretical part of your research, that is, आपके experiment, the research designs, hypothesis testing, sampling, all these things, assumptions of various tests, those are the things that you need to focus on majorly, because I think generally that is what is asked mostly. And stats, maybe it's nothing that you have to solve in the paper. There's not any complicated calculation as such, that they might just ask you ki average nikal lo. Those are simple calculation which can be done without a calculator also. So you don't need to be very well invested with the calculation part of the stats, but then the topics that I mentioned, जो research designs है, hypothesis है, correlation analysis है, all those things I think majorly is asked in the exams. So those are the portion that you can focus on. And the compiled list of books that will be given to you, I think that's going to give you a fair idea as to what to study from and where.
Okay, ma'am. Thank you.
निष्ठा जी एंड अनंतिका जी, एक सवाल है, चार्ट में पूछा गया, आई थिंक इट्स इम्पोर्टेंट. So when we come to diagnostic criteria of disorders, we have confusion whether we go with DSM-4-TR, DSM-5, or ICD-11-10. What will be your preferred way of preparing for diagnostic criteria?
I think what we were taught there was majorly focusing on the ICD-10 only. So I think that is there in all clinical institutions. I think they generally follow the ICD-10. So once you're preparing for your this thing also, I think it's important that you go through ICD-10 because they might pick up. Because I remember in my Viva, as in my interview, they did ask me question as in criteria from depression, and they asked me ICD-10 criteria of depression. So they can ask you like specifically from the book per se. So I think ICD-10. That's our preferred way to go about it.
Same.
Yes, yes, I completely agree. Even in our institutes, we were mostly using ICD. So ICD would be, I think, enough to study if you want to study the criterias.
Okay. Yeah. Perfect. So thank you, everyone. I think we should call it off now. We should wrap it up. And you also, lastly, you've been asking, I know there are a lot of questions that are still unanswered, and there will always be. So not everything can be answered. But I think that it was helpful for you. And I am really grateful to both of the panelists, Nishkaji and Antikaji, for their time and energy and sharing their experiences and knowledge with us, guiding us how to apply and how to prepare for the M.PHIL clinical psychology exams. If you have any more questions, you are always welcome to text us either on Instagram or any other platform that you are connected with us. As far as the resources are concerned, we have the resources on Power Within platform. Its test series or the book, the notes we have concised for the M.PHIL. You can definitely contact us regarding that, and we will help you out whatever necessary. We have a course also running right now for preparing for M.PHIL clinical psychology exams. I would happily share with you guys that Nishthaji and Anantikaji are the two educators that are helping the students in this course to prepare for M.PHIL clinical psychology. Okay. And Nishthaji and Anantikaji, there are a lot of messages coming up in thanking you for the session and your insights, your time for the session that you could be available and you helped us out. So, guys, these are the knowledges, these are the resources that we have. I hope that you have a better clarity now regarding the exams and preparation. You can come up with your questions to us, and on the behalf of Power Within, on the behalf of all the participants, I would like, finally, I would thank you, Nishtaji, Anantikaji, and Shivani, who is not here as of now, but yes, for your time and for your inputs. Thank you.
Thank you, Vishal. Thank you, Gushil, for having us, and thank you for all the participants.
Thank you, Vishal. Thank you, Gushil. And all the best to all the participants. M.PHIL, not cracking M.PHIL is not the end of the world.
Yes.
Definitely.
Okay, everyone take care. Bye-bye. Have a good day.
Bye-bye.
See you. Bye.
Bye.